Hello friends, welcome to mock test channel. Hope you are doing fine. Today we are discussing most commonly asked questions in PSSR Exit Exam. Friends, I will not ask you to subscribe to this channel, but please make sure that you hit on the like button. What marking must be clearly visible on a crane? Option A, manufacturer's logo. Option B, safe working lot. And option C, make of the crane. The correct answer is option B, safe working lot. The forecastle is H. Option A, stern of the ship. Option B, forepart of the ship. And option C, amidships. And option D, above the bridge. The correct answer is option B, forepart of the ship. What is the primary risk when working in enclosed spaces? Option A, hypothermia. Option B, lack of oxygen. Option C, claustrophobia. And option D, egress from that space. The correct answer is option B, lack of oxygen. Listening comprehension refers to option A, understanding an oral message. Option B, understanding a speech. Option C, understanding a passage. And option D, understanding an information. The correct answer is option A, understanding an oral message. Not making is difficult because option A, written language is different from spoken language. Option B, written language is difficult spoken language. Option C, written language is easier from spoken language. The correct answer is option A, written language is different from spoken language. If the engine of lifeboat does not start, check to see dash. Option A, that the fuel valve is open. Option B, if the air supply system is open. Option C, if the water sprinkler system is open. And option D, if the limit switch is on. The correct answer is option A, that the fuel valve is open. What is the spoken emergency signal for a distress signal over a VHF radio? Option A, red alert. Option B, security. And option C, mayday. And option D, pan. The correct answer is option C, mayday. When the survival craft is supplied with bottles of compressed air, they are used for option A, an air supply for personnel. Option B, additional flotation. Option C, primary the sprinkler system. And option D, filling the self-righting bags. The correct answer is option A, an air supply for personnel. A life should be launched by 2 persons. Option A, in less than 10 minutes. Option B, in less than 5 minutes. Option C, in less than 12 minutes. And option D, in less than 2 minutes. The correct answer is option B, in less than 5 minutes. By the signal meaning, this is best place to land is a dash. Option A, vertical motion of red flag. Option B, vertical motion of a white flag of the arms. Option C, white smoke signal. And option D, white star rocket. The correct answer is option B, vertical motion of a white flag or the arms. Where are remote readouts of oxygen concentration, pressure and temperature of an inert gas system required to be located? Option A, bridge and engine control consoles. Option B, bridge and tank being inserted. Option C, main deck and engine control consoles. And option D, cargo control and engine control consoles. The correct answer is option D, cargo control and engine control consoles. Which of the petroleum products listed has the lowest flash point? Option A, hydraulic oil. Option B, lubricating oil. Option C, diesel oil. And option D, refrigeration oil. The correct answer is option C, diesel oil. One consideration for determining the safest maximum rate at which bunker fuel may be received is by the dash. Option A, type of fuel transfer pump. Option B, size of the fuel storage tanks ashore. Option C, distance of the fuel storage tanks ashore. and option D, number of tanks to be filled. The correct answer is option D, number of tanks to be filled. Problem solving improvement in methodology and relationships and greater productivity are all signals of option A, delegation of duties, option B, good communication, option C, micromanaging team members, and option D, personal satisfaction team members. The correct answer is option B, good communication. Alcoholic hepatitis is the effect of alcohol on the option A, heart, option B, lung, option C, liver, and option D, brain. The correct answer is option C, liver. Chronic depression can cause option A, acute alcoholism, option B, chronic alcoholism, option C, breathing disorders, and option D, binge drinking. The correct answer is option B, chronic alcoholism. Which procedure should not be done for a person who has fainted? Option A, revive the person with smelling salts. Option B, loosen the clothing. Option C, lay the person horizontally. And option D, give pain reliever. The correct answer is option D, give pain reliever. Positive recognition for job performance is option A, improper or for person who meets but do exceed job requirements. Option B, used to help individual team members feel good about themselves. Option C, used by managers to convince employees to work harder. Option D, used only in group settings so as to not cause undue emphasis on a single team member. The correct answer is option B, used to help individual team members feel good about themselves. Amphetamine is a dash and an appetite suppressant. Option A, appetizer, option B, salt, and option C, stimulant. The correct answer is option C, stimulant. Which of the following probably would not be a helpful way to deal with the stress? Option A, developing a sense of humor. Option B, balancing work and play. Option C, spending less time talking about the problems with friends and family. And option D, consulting a professional counselor. The correct answer is option C, spending less time talking about the problems with friends and family. Which of the following causes stress? Option A, financial problem. Option B, social problems. Option C, neither financial and social problems. And option D, both financial and social problem. The correct answer is option D, both financial and social problem. Which of the following happens during a stress response? Option A, agility decreases. Option B, concentration scatters. Option C, reaction time slows. And option D, strength increases. The correct answer is option D, strength increases. As a stress management tool, being practical requires that you option A, require consistent perfect result from yourself. Option B, set realistic goals. Option C, recognize flaws in seemingly flawless plans. The correct answer is option B, set realistic goals. Which of the following is not a symptom of stress? Option A, pessimism. Option B, self-esteem. Option C, eating too much. And option D, smoking. The correct answer is option B, self-esteem. Which of the following statement is not true when you try to control others? Option A, it leads to conflicts. Option B, it gives you peace of mind. Option C, it makes you more angry. Option D, it causes stress. The correct answer is B, it gives you peace of mind. Thanks for watching. I wish you all the best for your exam.